Hi, everybody. Today we're going to be focusing on the digestive system, anatomy, and physiology. So looking at this picture, you can see the path of the digestive system starting from the mouth all the way to the anus. So what we're going to first take a look at is the path of food through the digestive system. We take a look at some of the microscopic anatomy of the system as well, and then dive into what is the function of each of these organs for the system. We also take a look at some of the main functions of the system as a whole. So let's go ahead and take a look at this. So we have our oral cavity or mouth, which opens up to the pharynx or your throat, and then it goes down the tube, down the neck and the thorax, called the esophagus, and the esophagus underneath the diaphragm connects to the organ called the stomach. Stomach continues to form or connects to the small intestine, which starts right about here, and it also continues to form the main folds in the center of the abdomen. The small intestine itself is made up of three parts. The initial part connected to the stomach is the duodenum. The folds more on superior are the jejunum, and folds on the inferior part are ileum. Ileum connects to the first part of the large intestine right here called the cecal. What we consider chyme at this point is going to now move up through the large intestine, forming the ascending colon, go across to form the transverse colon, come down on the side to form the descending colon, twist, which is this twisting as you can see right here, called the sigmoid colon, which ends in the rectum and eventually anal canal and anus. As part of the digestive system, you also have what we identify as accessory organs. So accessory organs are important because food does not pass through them. However, they do contribute to the process of digestion. These accessory organs include three types of salivary glands called parotid, sublingual, and submandibular. You can see them located again throughout your oral cavity. You have your tongue, and even though it's not labeled here, you also have your teeth that are considered as part of the digestive system, and they're all involved in mechanical digestion of your food. On the right-hand side, underneath your diaphragm, you have this large organ called the liver, and tucked in underneath the liver, you have the gallbladder. And then underneath your stomach, or partially covered by your stomach, you have your pancreas. Now, again, as we go through this PowerPoint, hopefully it will become clear what is the function of each of these organs. So let's go ahead and start looking at some of the proper terminology for the digestive system. First of all, food needs to move through the digestive system, and the proper way for movement of the food is called propulsion. Now, propulsion is basically what's depicted as the green lines within your digestive system. And again, you can see it kind of starts from your mouth and extend all the way to the anus. FYI, if you do see the word GI from this point on, that implies gastrointestinal. Gastro implies your stomach, intestinal as your intestines, large and small. Now, the act of propulsion is divided to swallowing, which is basically you put your food in your mouth, chew it, and you swallow it. And then the more, I guess, involuntary portion of the propulsion is a process called peristalsis. Peristalsis is contraction and relaxation of the muscles that allows the food to basically move and squeeze through the digestive tract. Kind of think about peristalsis as you're squeezing toothpaste out of the container. So as it gets pushed, it moves the food forward. And I have a picture for you guys to kind of see the peristalsis. Again, the contractions of the muscles, which are in this case the smooth muscle, as they contract, they move the food forward inside the digestive tract. So that's peristalsis, or part of or categorized as propulsion. Now we also have digestion. So we keep hearing the word digestion. Understanding the word digestion is the word itself means that the food gets broken down. We have two different types of digestion. We have what we identify as mechanical digestion and chemical digestion. Mechanical digestion, as the name implies, it includes some sort of force. So it could be the churning of the food in the stomach, it could be the action of chewing in your mouth, or the action of segmentation, which is the rhythmic contractions of the intestinal and the stomach muscles that allow the food to be mixed with the digestive enzymes and allow that to be effectively digested. So anything you see in purple arrows in your picture on the side is a depiction of the mechanical digestion. Again, you can see it happening in your stomach, and you can see it happening in the length of your small intestine. It doesn't extend to the large intestine because you don't really break down food at that point. The food is almost all breakdown, and you'll see that later on why that is. But limit the segmentation process and churning, which is part of digestion, to the stomach as well as the small intestine. Now, to kind of depict the segmentation for you, you can take a look at this picture. So again, notice that how the intestines are segmented, as in broken down to little pieces. Let's say you have a piece of food here, a piece of food here, and the separation or contractions are happening at these points. Now, as time passes by, these portions are going to relax, and you're going to have to contract right in the middle of these food or chyme, and that causes the food on the top and the bottom to be mixed together. This is allow your food to again mechanically broken down as it passes through the digestive tract. It also gives it an ability to mix with the digestive enzyme for a more effective digestion. Now, what we're describing up to this point is mechanical digestion. Again, it could be churning, segmentation, or simply chewing your food in your mouth. Now, what we identify as chemical digestion, which is the next category, is you have broken down your food to little chunks or little pieces. Now I'm going to break them down to the building blocks that my food is made up of. So if you guys kind of recall from your first or second lecture of the semester, we had three main food groups, which were carbs, proteins, and lipids or fats, right? Now, when you do chemical digestion, you're actually using a specific type of enzymes. Again, the key word here in chemical digestion would be using of enzymes or digestive enzyme more specifically. And you're going to break down these molecules of food to the building blocks. So for instance, for carbs, you break it to things we call simple sugar. For instance, your glucose. You have proteins broken down to amino acids, and you have your lipids broken down to fatty acid chains and glycerol or monoglycerides. So think about mechanical breakdown. Let's say you eat a piece of meat, right? Mechanical breakdown, all it's going to do is chop your little piece of meat to smaller pieces. But then when your piece of meat is mixed with the proper digestive enzyme, now you take those little pieces of meat, which are proteins, and you break them down to amino acids. Now understand that up to this point, everything we have discussed is happening within the digestive system. That includes producing simple sugar, amino acids, fatty acid, and glycerol from your three main food groups. Now, if you do not bring these into your bloodstream, then everything can be removed from your system, right? Because literally you remove them. So the last part of the digestive process is to take the nutrients that you have in your digestive tract and transport them into your blood vessels. And that process is known as absorption. Movement of molecule from the alimentary canal, which is again digestive tract, into your bloodstream. Now, any unwanted material that your body couldn't digest or it's simply unwanted will be removed through the process of defecation. So let's take a look at some of the vocabulary again, some of the accessory organs and the path. Please do note that you keep seeing the pictures that I have gone over earlier. So you really need to be comfortable with the locations of the digestive organs and its accessory organs for both lecture and lab. So alimentary canal, which is basically your digestive tract, it starts with your mouth. As I said, it goes down to your pharynx, which is your throat, goes down your esophagus, connects to your stomach, small intestine, and large intestine, and eventually goes through the rectum where the fecal matter gets stored, and through the anal canal and anus out of the body. We also mentioned you have accessory glands such as teeth and tongue associated with the oral cavity, and you also have salivary gland, liver, gallbladder, and pancreas as your accessory organs. Now, if you're looking at the alimentary canal is made up of 4 main layers. Now, these layers might be different from one organ or one portion of the digestive system, but that does not make it significantly different that would be absent in one layer. So these 4 main layers that basically line the alimentary canal from the inner to the outer is mucosa, submucosa, muscularis externa, and serosa. Let's take a closer look at what each layers look like. So mucosa, which is the inner lining of the digestive system. So if you think food is passing right here, the space the food is passing through is called the lumen, okay? And that lumen also applies to the blood vessels as well. So it's just a hollow cavity. So the first layer, which is basically covering the lumen and is coming into contact with your food, is the mucosa lining. As the name implies, they probably will produce a significant amount of mucus to lubricate the passage of food through the digestive tract. And itself is made up of epithelium, and this epithelium differs from one part of the digestive system to another. What we identify as lamina propria, which is basically connective tissue with a lot of blood vessels. And then muscularis mucosae, which is a very thin layers of a smooth muscles, which allows local movement of the mucosa lining. Submucosa, which is the second layer, so this layer right here, that's your submucosa. Submucosa, as the name implies, is underneath the mucosa. It will contain your main blood vessels that are basically supplying the digestive system. It also includes the main lymphatic vessels, as well as the nerve fibers. So basically, if you have a stomach ache, these are the nerves that are located that kind of give you that sensation. The third layer that we have, moving away from the lumen, is the muscularis externa. As the name implies, that means this is made up of muscles. Specifically, the category of the muscles would be smooth muscle. Now, a smooth muscle can create a specific pattern, and for most of the organs of the digestive system, you have 2 patterns of the smooth muscle. These are known as circular and longitudinal muscles. And you can kind of see the differences if you kind of look deeply into the picture. So this portion is one layer, and this portion is the second layer. So these both are your muscularis externa. Now, these muscles, these are smooth muscles, which their movement is involuntary, help your body carry out the process of peristalsis, which was basically moving the food through the digestive tract, and segmentation, which was a way of mechanically digesting your food. A stomach, as we go over that, also has a third layer called the oblique muscles, which is really important for the capacity of the stomach to carry its churning motion, which is also part of the mechanical digestion. Now, the outermost layer of your digestive tract is called serosa. Serosa is made up of epithelium layer as well as the connective tissue. Epithelium is simple squamous epithelium, which means basically a very thin layer of epithelium. However, do note that if this simple squamous epithelium layer is missing, so you only have the connective tissue, at that point we refer to this last layer as adventitia rather than serosa. So if you have both this epithelium and connective tissue, we call that serosa. And if you only have connective tissue, we call that adventitia. Let's take a look at some of the mesenteries that we have in the digestive system. So for you to understand the mesenteries, you have to kind of think back at the serous membrane we talked about, lining the internal cavities of the body. So we had three main ones we talked about. We talked about the heart, surrounded or placed inside a double membrane called the pericardium. We talked about the double membrane around your lungs called the pleura, and the double membrane around the digestive viscera called the peritoneum. Now again, this double membrane is parietal and visceral. Visceral would be the one that is directly in contact with your organs, and parietal would be the outer lining that comes into contact with the abdominal wall. What is the goal of having these mesenteries? They allow you to suspend many of your organs in place, for instance, your liver. And they also provide a significant amount of networks for blood vessels and nerves, as well as lymphatic vessels. So this is really a good mechanism for your body to basically gain access to the organs of the digestive system. Now, some of the main mesenteries of the digestive tract are listed here. So you have lesser and greater omentum. You can also identify them individually, which is basically lesser omentum and greater omentum. These are helping your stomach and other digestive organs to be tethered to the body wall. You have falciform ligaments associated with the liver, suspending the liver from the diaphragm and the abdominal wall. And you have what they identify as mesocolon, which is anchoring the transverse colon and the sigmoid colon to the abdominal wall. Again, these are not all of them, but some of the main ones that we have listed here. So here is your stomach. The curvature on the top of the stomach is called the lesser curvature. So this yellow layer that you see, that's your lesser omentum. The curvature you see at the bottom of the stomach is called the greater curvature. So this basically omentum that connects to that great curvature called the greater omentum. Right here you have your liver. Again, this dome-shaped muscle you see right here, that's your diaphragm. And this line that you see right at the center, suspending the liver on the diaphragm, that's your falciform ligament. Now, if I literally lift the greater omentum, underneath the greater omentum, I will see the folds of my intestines, which includes a large and a small intestine. Now, these mesocolons, as you can see, you can have transverse mesocolon, which is basically suspending the transverse colon right here. Or you can have what we call sigmoid mesocolon, which is helping your body suspend the sigmoid colon to the abdominal wall. Again, you really need to basically kind of secure these abdominal organs because nothing otherwise will keep them in place. Now let's go ahead and take a look at some of the organs of the digestive system, starting with the mouth, as well as the accessory glands associated with this. So let's look at the mouth. So your mouth is the mucosal lining of your mouth, which is basically what lines the mouth, is epithelium. The epithelium is going to be stratified. If you guys remember, stratified means many layer, a squamous epithelium. So basically you have many layers of flattened cells lining your oral cavity. And another characteristic you need to know that lamina propria, which usually contains smooth muscle, there is no smooth muscle in that layer. If you look at the roof of the mouth, you have part of the mouth that is covered with either the palatine process or the palatine bone. So that part becomes your hard palate. And if you go farther back, after your palatine bones end right about here, then there is no bone underneath that, so that's what's referred to as the soft palate. Soft palate ends with what we identified as the uvula. So this structure hanging in the back of the throat is the uvula. So when you swallow food, food comes down here, uvula moves that way. So it basically blocks the pharynx, so food cannot work its way back up to the nasopharynx. So basically you don't want food to go up to your air passageway, so you block it using your uvula. One of the main accessory glands inside our oral cavity is your teeth. So teeth have external and internal structures. So when you're looking at the external structure of the tooth, you have the part that is sticking out of your gum line, that's called the crown. The part that is going through your gum line, that's called the neck, connecting your crown to the last part of the tooth called the root. So root is part that is embedded inside your jawbone, get it be maxilla or mandible actually. And you can have between 1 to 3 roots per teeth. Now, do keep in mind that sometimes there are anomalies. I know somebody that actually had on one of their molars had four roots, but again, typically we start with, we will have 1 to up to 3 roots per tooth. Now, the internal structure as is depicted on a longitudinal cut of your teeth right here, what we have is the outermost layer of the tooth, which is basically what's visible to us, the white color of our teeth. That's called the enamel. Enamel is a super hard material that is protecting the underlying dentin, which is depicted in blue right here. Dentin is very similar in composition to our bone, which basically means it is made up of calcium, phosphate, and collagen fibers. And underneath your dentin, at the center of your tooth, you have a cavity called the pulp cavity, which contains nerves and blood vessels. So when you think about the cavity, kind of think about at the minimal level, you're damaging your enamel. If the cavity allows to continue and it's not being treated, you are going to damage the dentin. And then again, if it's not treated and it's not properly treated, then you will eventually reach your pulp cavity. Now, looking at your teeth, you have a total of 8 incisors, 4 on the top, 4 on the bottom. So these are depicted in blue, responsible for basically cutting your food. They are chisel shaped. You have 4 canine teeth, which are depicted, 1 on either side of the incisors, on top and bottom. They are responsible for tearing or shredding your food. And again, like if you think about dogs or cats or any animals that basically hunt, these canine teeth are much more pronounced. You have total of 8 premolar teeth, which are also called bicuspids. You have 2 of them on each side, and again, also on top and bottom. And lastly, you have 3 molar or tricuspids that are found on either side of your mouth and on top and bottom. Notice that the last of these molars are depicted in yellow. These are what we identified as wisdom teeth, and they are the ones that usually come in the latest in terms of replacing the deciduous teeth with the permanent teeth. Do keep in mind that when we're comparing the children's the children's teeth versus an adult. The children have what we identify as deciduous teeth. They have only about 20 of them. While we're comparing an adult, you have about 32 teeth that gets replaced depending on the individual. Looking at some of the dental conditions or dental disease, we have dental plaques. You can see on this picture, they're basically these yellow buildups you see on your surface of the teeth. These are a film of sugar and bacteria that adheres to the teeth because of either improper flossing or lack of brushing. Now, if you let these sugar film stay on the surface of the tooth, then the bacteria can use that sugar, right, and use it as a source of nutrients. But here's the problem. As the bacteria use this sugar, they produce an acidic byproduct. That acidic byproduct can eat through the enamel and the dentin. And that's what we identify as demineralization of enamel and dentin. So if I ask you as what is the reason you get cavities, is because basically when bacteria, which is present inside your mouth regardless, consume sugar, what they produce as a byproduct is basically an acidic solution. And this acidic solution can basically do what? Eat through both the enamel and dentin, and that's what we identify as demineralization. Now, again, if you don't treat it at the level of enamel and dentin, you will eventually reach your pulp cavity where you have the nerves and basically your blood vessels. And at that point, the individuals require what we call a procedure that's referred to as the root canal, where they need to go in and remove the blood vessels and nerves and replace it with innate material as well as antibiotic, and then cover your teeth with a fake or handmade crown, or man-made crown, I guess I should say. Another word that you may see, and you can see this again in terms of when you buy toothpaste, is gingivitis. And gingivitis is basically when the plaques are not removed from the teeth. They can damage the seal that is located between your teeth and your gum line. And that allows the bacteria to seep its way through your gum line. And again, anytime you have any sort of bacteria involved, that causes an inflammatory response. So you will see basically swelling or infection of the gum line, which appears as this kind of reddening right around your teeth line. Looking at the salivary gland, which is another accessory gland within your mouth, we have three types of salivary glands. The ones that are located on the side of the mouth, called the parotid glands. They contain a specific type of cell called Serous cells, and these cells are producing a very watery saliva. And I always tell my students to kind of think about it. If you think about or even eat something that's super sour, your mouth gets really watery. And if something is really pushing the boundaries in terms of sourness, you actually will feel pain on the side of your face because these parotid glands basically going to release a significant amount of saliva into your mouth, and that's where that pain comes from. Because basically they're trying to push a significant amount of saliva through this duct you see right here called the parotid duct. And as a lot of fluid passes through this, it basically creates a pressure that you identify as pain. Submandibular, as the name implies, it sits underneath your mandible or within your mandible, so that's your submandibular. Submandibular is a gland that contains two types of cells, the serous cells, which are responsible for the watery saliva, and what we identified as mucus cells, which basically, as the name implies, produce a more thick saliva. So submandibular produces a saliva that's thicker than the parotid gland saliva. The last type of salivary gland that we have sits underneath your tongue. So here's your tongue. Here is the salivary gland called the sublingual. Sublingual is mostly made up of mucus cells, which basically means it's going to produce the thickest saliva and release that into your oral cavity. Now, what is saliva that gets released from the salivary gland? What is its purpose? So salivary gland release saliva for the purpose of moistening your mouth, so that has a lot of water. It also has a concentration of ions like sodium, potassium. As we said, it contains mucus, depending on the type of salivary gland. It contains enzymes that helps with both digestion and releasing antibacterial components. And these are going to basically help your digestive system create basically the first line of defense against possible infective agents that enters through your mouth. So by releasing the saliva, you can protect yourself against some of the infective agents that enters. Now, we mentioned the word digestive enzymes. Again, remember digestive enzyme, and it's a big part of this class, guys, so make sure you understand it. Digestive enzymes are responsible for chemical digestion of your food, okay? So what is the enzyme that we have inside our saliva? That's amylase. That's amylase. So what is the job of amylase? Amylase is responsible for, again, chemical digestion. I'm going to say chemical digestion of carbohydrates. So if I ask you guys a question and I said, mechanical breakdown of your food starts in, mechanical breakdown of protein starts in your mouth. Again, the keyword would be mechanical. And is that a statement true? Mechanical digestion of protein starts in your mouth. The answer is yes, because even though it's a piece of meat or a protein, I'm still gonna chew it, which is the mechanical digestion. However, if I replace the word mechanical digestion with chemical digestion of your food, then you basically will not have chemical digestion of protein. So that statement therefore is false. So if you think about mechanical digestion, I'm going to write this for you guys. Mechanical digestion, which is basically your chewing action. I can do carbs, I can do proteins, and I can do lipids. Doesn't matter, right? But if I'm using the word chemical digestion, right? The only option that I can add here would be what? Your carbs, because I will not have any other enzymes that helps me with the digestion or chemical digestion of my proteins or lipids. So again, the name of the enzyme that's going to do that would be your amylase. Pharynx is the structure that connects to your oral cavity. It also connects to the nasal cavity for the passage of air. So in reality, when you look at your pharynx has three parts. The part that is right behind your nose, which is right here, this area is called the nasopharynx. The second part, which is right behind your oral cavity, is called the oropharynx. And going farther down, associated with your vocal cord or your larynx, is called the laryngopharynx. Now, when we're thinking about the respiratory system, and I want to kind of introduce that topic, I know it's not something we're discussing right now, but it makes it easier for you guys to understand. When you basically breathe air in, it comes through your nose, it goes through the nasopharynx, oropharynx, laryngopharynx, and then it takes the path of trachea to end up in your lungs. When you eat your food, food comes through the oral cavity. Remember, uvula is going to block the food from going to the nasopharynx. So food comes in, it goes through the oropharynx, laryngopharynx, and then chooses the path to go down your esophagus and to your stomach. So make sense of the passage of food through the pharynx. Understand that pharynx, it has 3 parts, but in terms of digestive system, only the oropharynx and laryngopharynx are going to be involved in the passage of food. Esophagus, which is basically a muscular tube, allow us to complete the process of degglutination or deglutition, which is basically swallowing. It is made up of 2 types of muscles. So you have a skeletal muscle and a smooth muscle. So a skeletal muscle portion, which is about the first 1/3 of the esophagus. So I've kind of depict this for you guys. So if you're looking at your esophagus right here, the top 1/3 of your esophagus is only a skeletal muscle, which basically means you can freely swallow your food. It's under your control. Somewhere in the middle, the second half or second, I guess halfway through, let's leave it at that, is a combination of both a skeletal and a smooth muscle. So this is where you're basically transitioning. The last 1/3 is only a smooth muscle. So the closest to the stomach is only smooth muscle. So that part is basically you have no control over your swallowing process. It's not swallowing anymore, actually. It's going to be now peristalsis as the food on its own moves down your esophagus. And I kind of give that example to my students sometimes to think about when sometimes food gets caught in your throat. Sometimes you can kind of do this action of swallow, 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 right? And the food is able to move downward. However, sometimes when the food gets caught, regardless of how hard you're trying to swallow, that food is not going anywhere, right? So you have to basically drink something or lubricate it for the movement to happen. So the main reason is because, again, if it's farther up the esophagus, you have control over those muscles. But as you go farther down the esophagus, the muscles become smooth and the movement becomes involuntary. When your esophagus is connecting to your stomach, so if here is my esophagus, here is my stomach, the points where these are coming into contact with each other, you have a sphincter, which is a circular muscle at the opening of the stomach, called the lower esophageal sphincter, also can be called the cardiac sphincter. Because if you kind of think about this logically in terms of position, give me 1 second, let me just change my pen color so I can depict that for you. If that's my stomach, here is my diaphragm, that line is my diaphragm, and my heart would be sitting right here. So this would be my heart. Not the best picture, but if this is my heart, sometimes my thing doesn't work properly. Here is the esophagus, and again, as you pass the diaphragm, you connect to the stomach. So because of the proximity of this sphincter to the heart, we refer to that as the cardiac sphincter. Now, let's go ahead and talk about the anatomy of the stomach. So stomach is made up of 4 sections. You have the region that is right where the esophagus connects to the stomach, which is basically where your cardiac sphincter is. It's called the cardiac region. You have this dome shape of your stomach called the fundus. You have the midsection of your stomach called the body. And then this funnel ending for your stomach called the pyloric region. So cardiac, fundus, body, and pyloric region. We also talked about the lesser curvature of the stomach and the greater curvature of the stomach. Another thing you can note on this picture is the fact that your stomach has 3 layers of a smooth muscle. If you recall, we said the muscularis external layer typically has two layers, which are longitudinal and circular. However, as I mentioned before, a stomach has an extra layer. It is the deepest layer or the innermost lining called the oblique layer. So here's basically the three layers. What you also can see is the folds that are found inside the intestine, inside the stomach. These folds are referred to as the rugae. And the purpose of the rugae is to allow your stomach size to expand as you consume food. So to give you a few numbers, when your stomach is empty, all of these folds are kind of collapsed on themselves, and the stomach is relatively small, which is about half a liter. A small, basically a typical water bottle. Now the stomach can increase its size up to 4 liters, and this is an average person, by opening all of these folds of the stomach. And by doing that, again, it can expand its size up to 8 times its normal size. The way I tell my students is to depict this or imagine this is, think about when your stomach is empty, it's kind of like a crumpled piece of paper. When you start to open up that basically crumpled piece of paper, you can see the size literally expanding, right? So that's exactly what happens in your stomach. The more you eat, the more these folds open. Now, at the end of your stomach, where you basically connect to the duodenum, which is the first part of the small intestine, you have another sphincter, which is right here. Because of its proximity to the pyloric region, we refer to this as the pyloric sphincter or gastroduodenal sphincter. Again, break down the word for yourself. The word gastro implies the stomach. Duodenal implies your duodenum, which is the first part of the small intestine. What are some of the main functions of the stomach? The stomach has the ability to start absorbing some nutrients. Now, these absorptions are minor and specific. Absorption include absorption of alcohol, water, electrolytes like sodium, potassium, calcium, some of the drugs like aspirin, which basically, if you consume it on an empty stomach, can cause damage to the lining of the stomach. The lining of the stomach is a simple columnar epithelium. You have the main mechanical digestion of your food. So let me add this, I don't have it specifically here. So you have mechanical digestion of all food groups. And this is through the action of churning, right? We mentioned that earlier. You're also going to initiate the digestion, chemical digestion of proteins. Again, anytime you hear the word chemical, do remember that that means you need an enzyme. This enzyme is an enzyme called pepsin. You can initiate the digestion of other proteins and fat. And this has nothing to do with the enzyme. This has to do with the acidic environment of the stomach. You have a storage of the food until your stomach can pass that food to your small intestine. You have mixing of your food again through the churning action and release of some gastric secretions, which is again, the main one would be the acidic environment. And again, when it's done, you release that material into your small intestine. Now, let me clarify a couple of things before we move on from this slide. So inside the stomach, you have pepsin. You have an acidic environment created by an acid, a very strong acid called hydrochloric acid, or HCl. You have a significant mechanical digestion, which is basically churning of your food. So if you take all of these together, by the time the stomach is done with, quote unquote, your food, your food does not resemble anything that you started with. So at that point, when that food is leaving, and again, I put that quote, food in quote unquote, when that is leaving, we don't call it food anymore. We're going to be referred to it as the chyme. So because the changes is so significant in terms of the characteristic of what we identify as food, so it's not referred to as chyme from this point on. So it will be referred to as chyme from this point on, not food. Now, what are the cells that are found inside our stomach? So there are quite a few categories actually. So I've listed them here, and it does get complicated. So let's go ahead and start it, and we'll try to keep it simple. So remember, as I mentioned, the stomach is acidic because of the presence of HCl, and you also have an enzyme that is chemically digesting your proteins. So both of these can cause damage to the organ stomach itself. So what's the way for us to prevent that from happening? You line the stomach with a very thick layer of mucosa using cells called mucus neck cells or goblet cells. So the inner wall of your stomach is literally covered with a thick lining of the mucus, which is created by the mucus neck cells or goblet cells, protecting your stomach from acidic environment as well as the enzymatic digestion. You also have a specific type of cells called parietal cells. Parietal cells are the one responsible for creation of hydrochloric acid. They also produce something called the intrinsic factor. So what is the goal of parietal cells producing these? Two reasons. HCl creates an extremely acidic environment that can destroy a lot of the microbes or pathogens that enters through your digestive system. It also can initiate the digestion of fats and proteins. And one last one that I do want to add, it also required for activation of pepsin. And I'll talk about that in just a minute. Again, pepsin is the digestive enzyme for proteins. Intrinsic factor is important, not in terms of a stomach, but it actually goes into the small intestine and helps with the absorption of your vitamin B12. Now, we already talked about pepsin, the fact that pepsin is helping you with the digestion of the proteins. But what actually produce pepsin are a specific category of cells called chief cells. Now again, notice again, chief cells are producing pepsinogen, which is an inactive version of pepsin. When pepsinogen gets interacted with the acidic environment of the stomach, then it becomes pepsin, which is the active version, and that helps with the protein digestion. Now, what gives your parietal cells to create HCl is a specific type of cell called enteroendocrine cells, which release something called gastrin, and that helps you release HCl. So let's take a look, kind of bring everything together. Oops, sorry, keep clicking on the wrong thing. So let me depict this for you guys on a screen. So hopefully this will become a little bit easier. So we have your enteroendocrine cells producing what? They produce gastrin, right? Gastrin goes and targets your parietal cells, right? Sorry, apologies for the spelling. And parietal cells is now going to create two things. One is HCl, and the other thing is intrinsic factor, right? Now, At the same time, you have your chief cells producing what? Pepsinogen. Now, pepsinogen with the acidic environment created by HCl is going to activate your pepsin. And pepsin is going to help you break down your proteins into amino acids. And intrinsic factors are going to go to your small intestine and help with what? Absorption of vitamin B12. So please make sure you guys are comfortable with this. You do have exam questions to be able to distinguish what are the jobs of each of these cells and what happens if these cells fail to do their job. Looking at a couple conditions, we have gastric ulcers for the stomach. Please, first of all, note that gastric ulcers have nothing to do with the stress, even though there is a typical misinformation out there. Gastric ulcers are a result of a bacteria called Helicobacter pylori, which is basically a bacteria with a drill head. You can see the green pictures right here. They have the capacity to create a hole or opening inside the mucus lining of the stomach, which is that protection layer. And through that, they basically can cause holes, what we identify as ulcers. This can cause pain and discomfort, heartburn, nausea, intolerance to fatty food. However, again, note that this is a bacterial infection, which means it can be treated by a treatment of antibiotics. Now, again, if you do have gastric ulcers and you continue eating the same type of food, even if it gets treated, there are chances that that gastric ulcer will come back because that bacteria will be present in in specific categories of food at a higher concentration, which means typically you can have a history of gastric ulcers. We have what we identify as acid reflux or heartburn. This is when your lower esophageal sphincter, which is depicted right here, also known as your cardiac sphincter, does not close properly, which allows the acidic environment of the stomach to travel up through the esophagus. And remember, the esophagus is not equipped to handle the acidic environment. It doesn't have that thick mucus lining. So when this acidic environment enters the esophagus, it literally damages the esophagus. So that causes pain, discomfort, and again, all the feeling, what we identify as acid reflux. Your body has the capacity to heal itself. However, the new research has shown that if you have continuous acid reflux, this could eventually lead to esophageal cancer. Because every time those cells try to repair themselves, there's a higher chance of them developing abnormalities. What are some of the factors that contribute to acid reflux? You have obesity. Again, that means there's more acid, that means that is more food, and that a sphincter has an easier way of, or I guess a harder way of controlling the acidic environment and maintain it within the stomach. Failed cardiac sphincter, which is basically if the sphincter doesn't work properly, the acidity can reach the esophagus. Pregnancy in many cases can lead to loosening of the sphincter, especially if the estrogen levels are higher, that sphincter can be even further loosened, which causes acid reflux to be severe. And the other reason is basically there's less room inside the stomach, inside the abdominal cavity for the stomach. Therefore, there's a higher chance of that food getting pushed up through the esophagus. And you also have possible hernias. I don't discuss with you guys, but again, you can have hernias within the abdominal region that can cause acid reflux. What are the best way to prevent the acid reflux? You can avoid eating heavy meals. Basically, the more food you eat, the higher the chances of increased levels of acid, which can cause more damage to the esophagus. Avoiding sleeping right after meals or doing exercises after meals. Both of those put extra pressure on the lower esophageal sphincter, which cause you more susceptible to acid reflux. And weight loss, of course, will also contribute to lowering the acid reflux. Okay, I'm going to stop here, and then we'll continue the digestive system with the next presentation.